Hi, I am Jeannie Halverson, and I am a fourth-year medical student at the Asheville School of Medicine. And for my final exam, I am being tested on my ability to diagnose patients with seizure disorders. And so next you will see me with my attempts to diagnose several patients. Hello, Jordan. I'm Dr. Halverson.
Hello, nice to meet you.
Nice to meet you too. How are you feeling today? What's going on?
Well, I've been feeling great recently. I've been experiencing episodes of ringing and numbness all over my body, as well as a general disorientation.
All right. How long do these periods usually last?
Typically, they last less than 2 minutes.
All right. And are other people telling you that this is happening, or do you remember?
I generally remember the episode and I'm conscious of being disoriented. I just can't control the ringing and I can't get it to go away.
Okay. And have you recently had any head trauma?
I did. I have had I got in a severe car accident about 12 months ago and had a pretty bad concussion from that.
All right. Well, to me, this sounds like you're experiencing simple partial seizures, which often causes change in consciousness, but does not cause loss of consciousness. And it starts from a focus and remains localized. So for this, I'm going to put you on a ketogenic diet, which changes what your brain uses for fuel from glucose to ketones, and it's high in fat, medium in protein, and low in carbs. And it should alleviate some of these experiences that you're having.
Okay, thank you.
You're welcome. Hello, Kristen.
Hi.
How are you doing today?
I'm fine. How
I'm
are
Dr.
you?
Halverson. What's been going on with you?
Well, last weekend I went home for Thanksgiving, and I was eating with my family, and then woke up in my bed, and my family seemed concerned.
Okay, and during this period, which you don't remember, what exactly did your family notice?
They said my muscles were contracting, I wasn't breathing, I was kind of jerking around on the floor.
And how did you feel when you woke up?
Exhausted and confused.
Okay, well, to me this sounds like a grand mal seizure. The beginning of this is called the tonic phase, in which all of your skeletal muscles contract, and then the clonic phase begins, where you start jerking. And a lot of people experience an aura before this, which is presumably caused by excitation of neurons surrounding the seizure focus. And so for this, most people who experience grand mal seizures, they don't experience them again. So I'm not going to give you anything today. But if it happens again, you'll have to come back in and we'll check for epilepsy, in which I'll give you some anticonvulsants. And if that happens, then they're probably going to revoke your license.
Man. All right. Well, thank you very much.
You're welcome. Hi, Morgan. Hi, Penelope. How are you guys doing today?
Hi, we're good. This is Penelope. Oh, she spaces out and she's confused often.
Okay, how often exactly does this happen?
A lot, but only for a few seconds.
What exactly does she do?
Look at her now.
Okay, well, this is actually extremely common among young children. They're called absence seizures, and they'll go away with age. But if they don't, we'll have to test for ADHD. But for right now, I wouldn't worry about it.
Okay, thank you so much.
You're welcome. Hello, Sterling. What's wrong with you today? How are you feeling?
Well, Dr. Halverson, I consider myself a recovering alcoholic.
What exactly does that mean?
Well, I quit cold turkey about 2 days ago. And now I'm experiencing seizure-like symptoms and high fever.
Well, Sterling, quitting cold turkey isn't always the best option. It can sometimes induce seizures.
Ooh.
See, what happens is long-term suppression of the NMDA receptors caused by chronic alcohol intake results in supersensitivity, a compensatory mechanism produced by long-term inhibition of the receptors. So when an alcoholic suddenly stops drinking, the NMDA receptors, which have been suppressed for so long, suddenly rebound.
So what do I do?
So my advice for you is to drink this beer and taper off slowly.
Ooh, a tall boy, my favorite.
Those are my last 4 patients. How do you think I did?